This presentation is on offenders with a history of trauma. How is trauma defined? Trauma requires both a specific kind of event and a specific kind of reaction to that event. The wider definition focuses on the individual's experience to negative events. As defined by the Substance Abuse and Mental Health Services Administration, individual trauma results from an event, series of events, or set of circumstances that is experienced by an individual as physically or emotionally harmful or threatening, and that has lasting adverse effects on the individual's functioning and physical, social, emotional, or spiritual well-being. In short, trauma is the sum of the event, the experience, and the effect. Under this definition, trauma has a wide range of events that could have happened once, be ongoing or chronic, personal or impersonal. The events listed are usually referred to as having a traumatic effect. Emotional, physical, and sexual abuse, neglect, assaults, bullying, witnessing family, school, or community violence, war, racist victimization, acts of terrorism, disasters, serious accidents, serious injuries, loss of a loved one, abandonment, or separation. So how common is trauma? An estimated 70% of adults in the United States have experienced a traumatic event at least once in their lives. And up to 20% of these people go on to develop post-traumatic stress disorder, or PTSD. An estimated 5% of Americans, more than 13 million people, actually can have PTSD at any given time. People's responses to trauma include anger, aggression towards others, self-destructive and suicidal behaviors, substance abuse, and include antisocial behaviors. Trauma is a very prevalent experience among U.S. offenders. 90% of offenders have experienced a traumatic event. 70% of those offenders have been exposed to trauma as a juvenile. Men and women equally report having experienced at least one traumatic event in their life. Of those, 83% men and 79% women. And of those men and women, 30 to 60% experience post-traumatic stress disorder. The range is wide because there's a difference between genders and when they experience their traumatic event. Rates of childhood and adult trauma are high among those incarcerated. The relationship between trauma and incarceration is complex because there's a clear link between traumatic experiences and criminal behavior. Over half offenders with a history of trauma experience their traumatic event during childhood. 1 in 6 male inmates report being physically or sexually abused before the age of 18. And many more witness interpersonal violence as they reach legal age. The prevalence of trauma and PTSD is high in urban low-income communities, with nearly 1 in 4 adults in these types of neighborhoods actually experiencing PTSD. Individuals from socially disadvantaged communities are more likely to experience both trauma and involvement with the criminal justice system. There's also a range of behavioral and clinical symptoms, including depression, anxiety, and aggressive and addictive behaviors. Child abuse and neglect, poverty, sexual molestation, and witnessing violence are among other traumatic experiences. The most common risk factor for post-traumatic reactions include aggression and antisocial behavior. Traumatic experience also can occur while incarcerated. About 20 to 25% of the population experience or witness some form of physical and/or sexual abuse. Without intervention, trauma-related symptoms may persist over time. There are a couple of treatment programs that have proven to be effective when treating offenders with a history of trauma. Both the Seeking Safety and Trauma Effect Regulation, the Guide for Education and Treatment, are evidence-based programs proving to decrease traumatic symptoms and recidivism. The Seeking Safety treatment program is designed for individuals with PTSD syndromes and a history of substance abuse. The model teaches the connection between trauma, coping skills, and substance abuse using a cognitive behavioral approach. Some of the topics covered include coping skills such as compassion, self-care, anger management, and asking for help. This treatment proves to be beneficial amongst women prisoners. Trauma Effect Regulation, a guide for education and treatment, both empowers and challenges. The guide teaches skills to manage how an individual responds to a traumatic event by identifying stressors and deciding how to react to that event. The goal of this treatment is to help trauma survivors become more focused and mindful, to help them make good decisions, and to help build healthy relationships. Other treatments include prolonged exposure therapy, which strives to teach clients how to safely remember and process traumatic events and reduces PTSD symptoms along with depression, anger, and anxiety. This is achieved by having the client repeatedly encounter activities that are a reminder of traumatic events and revisiting the traumatic memory by retelling the event. There's also the trauma recovery and empowerment model that incorporates group intervention for trauma survivors with severe mental health disorders. There are 5 general topic areas that aim to address the consequences of violent victimization that include PTSD, depression, and substance abuse. These 5 topic areas include empowerment, trauma recovery, advanced trauma recovery issues, closing rituals, and modifications or supplements for special populations. This form of treatment is promising among research evidence. The treatment specifically reduces anxiety symptoms among offenders. The following psychological measurements have been used and proven to help when assessing an offender with a history of trauma. Adult self-reports such as self-questionnaires measuring depression, anxiety, thought problems, and aggression. Also, self-questionnaires measuring use of substances. Measuring trauma exposure with questionnaires and interviews exposes traumatic events and its severity. Also, PTSD screening that includes structured interviews that assess mental health, questionnaires and surveys targeting the actual symptoms and thoughts about the traumatic event. The PTSD checklist in the DSM-5 includes an informative self-report that measures symptoms of PTSD. The screening is essential when treating trauma history among offenders. So what's missing? Although there are a variety of evidence-based programs available designed to help individuals cope with PTSD in a correctional setting, there's little research done on effective treatment for the male adult population. Sufficient evidence of treatment supports improving women and juvenile offenders. However, research is lacking when it comes to offending men with a history of trauma. Adolescence is a critical period of development. There are a variety of opportunities to help individuals recover from traumatic events that they have already experienced, and it promotes resilience to help them face potential future events. Positive youth development programs focusing on competence, confidence, connection, character, and caring can prove to be beneficial. These programs can help youth develop strong relationships with peers and family, access positive role models, and connect to supportive institutions early. Program efforts should focus on opportunities to help youth develop positive relationships with responsible and caring adults, build social and emotional competence, and develop feelings of confidence. These characteristics can be promoted through a variety of different programs, included but not limited to mentoring programs, social emotional learning programs, and after-school programs. This concludes my presentation. Please respond to the following questions for discussion. Repeated trauma throughout life can be most found among incarcerated men. So why is there little research supporting effective treatment for this population of male offenders with a history of trauma? And how can the prison system reduce PTSD among offenders with a history of trauma? Thank you.